Hi gang, and welcome to Unit 4. Today we're going to focus mostly on the disorders of neutrophils, but I'm also going to add in a little bit about disorders of monocytes and macrophages as well. So today we're going to talk about the abnormal neutrophil function, and those diseases that are included for abnormal neutrophil function would be things like Job syndrome and lazy leukocyte syndrome. We're also going to talk about the congenital neutrophil abnormalities, including Shinya-Higashi syndrome, chronic granulomatous disease, complement receptor 3 deficiency, myeloperoxidase deficiency, specific granule deficiencies, and then we're going to move on to the disorders of monocytes and macrophages, and that would include Gaucher's disease and Niemann-Pick disease. So stay tuned as we go throughout the lecture discussing disorders of neutrophils, monocytes, and macrophages. So some abnormal neutrophil function disorders that we're going to talk about today would be Job syndrome and lazy leukocyte syndrome. Job syndrome is from a defective phagocytosis. People that have Job syndrome have skin and subcutaneous abscesses, and many of the times they have severe Staphylococcus aureus infections. They have very little inflammatory response in patients, and their phagocytes are actually unable to kill bacteria. So that's a little bit about Job syndrome. That brings us to my favorite neutrophil disorder, just because of the name. That would be lazy leukocyte syndrome. In lazy leukocyte syndrome, the neutrophils are unable to reach the site of infection because they have a defective chemotactic response. People that have lazy leukocyte syndrome also have severe neutropenia. Patients here have repeat bouts of bacterial infections. That brings us to the congenital neutrophil abnormalities, and today we're going to cover Shinya-Higashi syndrome, chronic granulomatous disease, complement receptor 3 deficiency, myeloperoxidase deficiencies, and specific granule deficiencies. So let's start by discussing Shinya-Higashi syndrome. So Shinya-Higashi syndrome is a disorder of neutrophils. It is hereditary and it can be fatal by the age of 6. Okay? People that have Shinya-Higashi syndrome have frequent skin infections, and their patients have little pigment in the eyes. This condition also causes albinoism in cats. Okay? So patients are usually highly photosensitive, and the leukocytes have large granules inside. Chronic granulomatous disease, or CGD, is the result of a congenital condition where the patients have an inability to produce superoxide. Superoxide is similar to peroxide. It's an oxygen-dependent killing mechanism of the body. It is a hereditary disease mostly found in infant males, and it is usually deadly by the age of 7. People that have CGD have repeat infections with enterics, staphylococcus, and yeast infections. Their neutrophils don't accumulate H2O2. Neutrophils don't accumulate hydrogen peroxide, and thus organisms are engulfed, but they're not killed. Their T and B cells are normal, and their complement function is also normal, but these patients tend to get granulomas. And granulomas usually are an accumulation of macrophages around the site of infection. So that's chronic granulomatous disease. Complement C3 receptor deficiency is a deficiency that is a rare autosomal recessive trait. It is characterized by a decreased aggregation of neutrophils to each other activation. People that have complement C3 receptor deficiency also are prone to many bacterial infections, and they do have a depressed inflammatory response. A myeloperoxidase deficiency is when phagocytes lack the enzyme myeloperoxidase. They lack this enzyme in the granules of their neutrophils. Patients are prone to having infections, especially fungal infections, because other enzymes have to take up the slack. And that brings us to the specific granule deficiencies. These are autosomal recessive diseases, neutrophils are unable to synthesize specific granules during differentiation of the neutrophils in the bone marrow. And so these patients end up getting bacterial infections of the deep tissues. Then we have the disorders of monocytes and macrophages, and this would include Gaucher's disease, which is a genetic disease in the Jewish population. And we have Niemann-Pick disease, where there is an enzyme known as sphingomyelinase that is absent or very decreased. So in Gaucher disease, like I said, this is a rare genetic disorder. Usually it is found in people of Jewish descent. And these folks are lacking an enzyme known as alpha glucocerebroside, and that is very deficient in these patients. Okay. In Niemann-Pick disease, patients are lacking the enzyme sphingomyelinase, which is very deficient or lacking, and so cholesterol starts to accumulate in their liver and spleen. There are a number of different lab assays for phagocytic function, including chemotaxis assays, which measure cell migration, ingestion assays that test the ability of phagocytic cells to ingest bacteria, and finally we have killing assays, which measures bacterial killing by neutrophils. Okay, so using chemotactic assays, ingestion assays, and killing assays are ways that we can assess phagocytic function in our patients.